Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about outsourced medical coding. What does that mean? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got this message and this message inspired today's episode. So I'll read the message and we'll get into it. So here we go. Hi Blue, I just passed my CPC exam on my second try on Friday. I wanted to thank you for your YouTube channel because it gave me motivation to not quit on my career goals. Even though coding at my hospital system is being outsourced to save money, co-workers have told me that medical coding certification was beneficial because coding is directly tied to revenue reimbursements. I'm excited to grow within the revenue cycle at my hospital. Thank you. And I said, awesome, congratulations. Thank you for watching. There are other places you can apply that do not outsource their coding work. And of course comes back and says, right now I plan to focus on building experience in denial management role for the next year to build my resume. I've heard words of a lot of Colorado hospital systems are outsourcing their coding work. I have an upcoming meeting with my manager this Friday to discuss possible coding opportunities. So they said it was being outsourced and then now they're talking about coding opportunities. Okay, so here's the thing, guys. When it comes to medical coding that gets outsourced at a hospital, there are two types of outsourcing. Outsourcing the coding to go to a coding management company that's what they do. They are a coding company. They have coders and they code everywhere and they can code for anything because they have such a diverse staff. You know, that's one outsource meaning. The other outsource meaning, of course, is when they try to send it overseas. The problem with sending medical coding overseas is that these people that are overseas speak another language. That's their other language is their first language. It's not English. And these documents are written in English, medical terminology English, that is difficult for even native English speakers to understand. So there comes a lot of problems with the misunderstanding of the documentation. I know because I've personally seen them do this. And having it has to come back and get corrected by an English speaker because then there are denials. Because then whoever's in charge of doing the outsourcing is thinking that they can send it overseas for cheaper labor. Well, you get what you pay for. And again, it's just because they don't speak English as their first language. So some of the words can get messed up. You know, like cardiac lead and lead poisoning was one that I saw. And there's a bunch of other examples that I could totally go into another episode on. But the thing is, I want you guys to understand this. That just because they're saying they're outsourcing doesn't mean that it's going overseas, doesn't mean that you won't be able to have a job. Sometimes hospitals will do this to save on the long term. Because if a hospital hires coders, then obviously they're going to have to offer them benefits and things like that. So these benefits are long-term benefits. So if a person stays 20, 30 years with that company, and if the company offers a pension, now they're going to have to pay out a pension. So long term, while they would have good quality work, right, it's a long-term investment because they still have to pay this person even after they retire. So a lot of times these people who do the numbers, these bean counters, if you will, for these hospitals try to look for ways to save money. Well, unfortunately, you can't really cut corners saving money when it comes to coding because the benefits of having a coding staff that is well educated and is serious about their work is a really big benefit to that facility. Because if you don't and you have incompetent coders coding for you, or people who just don't care, or they're working for a company and there's really not a whole lot of benefits to working with that company, so they have a high turnover all the time, you never know what you're going to get. And with that, you get a lot of denied claims a lot of times. And there's no consistency with the coding. So there's a lot of bad things that happen. And again, because people don't understand what we do and they think they know, which is why these things happen. But not everybody is like this. You know, they said that they were hearing words about the state of Colorado that a lot of the hospital systems are doing that. That is not true. You know, Colorado, not as big as Texas, but Colorado is a big state. And not only that, they have plenty of healthcare facilities that have their own coding in-house. There are plenty that they hire coders, they don't outsource their work, they have them in-house, or they have somebody who's a part of that in their own little department. So that's the thing, guys. You can't always believe what you hear. What it sounds like to me, and again, all I know is what I have here from what they said to me, which was, everybody says it's a good thing that they're certified, and they said they're going to outsource, but they're going to talk about possible coding opportunities. What it sounds like to me is that they have their coders outsourced, but they have a billing department in-house. And so what happens is, if there's a problem with the codes that were coded and it goes to the billers and the billers send it out and then there's a denial, then maybe that coder is going to be fixing that. And so that's where they get their coding experience. It could be that. So sometimes you have to be careful about who you listen to when it comes to, oh, well, yes, it's good, but, or yes, I want to get my experience here. And okay, so it's fine. It's fine if you want to get your experience in the revenue cycle first. A lot of people do it. A lot of people get their bearings first in billing before they start going into the coding, because maybe they didn't go through a good medical coding program that taught them as well as they should have. And they realize that the real world is way different from, the book world. So that's the thing, guys. You have to think about that. When it comes to talking about, oh, it's going overseas, and see, that's the thing. People will hear that, or they'll automatically hear outsourcing and they'll automatically assume that it's overseas. And that's not always the case. And if you're trying to apply for a hospital and you say, well, I want to, do the coding and things like that, and they say, well, we have another company that takes care of that. Find the company name, find out who they are, ask, and then go apply with them directly. It may or may not work, okay? It all depends. But what happens when you are working for a company that is not in-house of that facility is there's a lot of different places that you could be coding for, okay? So if you're working for one of those outsourced medical coding companies and they get the contracts, because that's basically what they do at that point, is these coding companies will have contracts with these hospitals. Sometimes they get the contracts for all the rural hospitals, so that way, because it's such a small amount that it doesn't make sense to have somebody there, even though it does. I would always argue to have a coder in-house, but I can understand in a population that is really small, in a really small facility, why it would be outsourced to a private company to take care of that coding. But if that is the case, you get all the different hospitals in that area that are maybe all the rural for hospitals, for example, and you would work, remotely and that kind of thing. That's usually how it goes. When I worked for a level 1 trauma hospital, that's what I did. And we had all of the companies that were around my state, but they had contracts all the way up in Pennsylvania as well. And so it really all depended on who needed help. But we were all over the place. Like the remote coders were all over the place. Like that was their stations. And they worked wherever they needed to work. And so a lot of the places that I worked with were in Oklahoma, somewhere in Kansas, I think, and then Missouri was where I worked at, those hospitals in there. So, again, it just all depends on which company that you're working for. The drawback to working for an outsourced medical coding company is that you're not in-house to talk to your providers. You can send them queries, but again, you are a voice on the computer and you're an email person and you're somebody they see occasionally in email traffic. And so if you're not in the area, which I was not, these hospitals were hundreds of miles away from me. And so it's not like I could just drop in. So that was one of the things that it was hard for me, because I like talking to my providers. I like building those relationships, because even though sometimes it may be difficult at first, because sometimes they resist you in the beginning, and that's okay. If it wasn't a challenge, it wouldn't be fun, right? So but once you get over that initial, resistance, and you start to build those relationships, the documentation gets much better and you can move a lot faster through it. So what would happen with us is that we could send a query, but if there was a bigger problem, like a more ongoing problem, we would have to contact our lead. Our lead would contact the coding educator that was in-house, and then, or sometimes it was a nurse. I don't know why they think the two can do whatever, but they do. And so sometimes nurses get put a lot on their plate, not just the nursing side, but they get also the coding side. But it just because you're a nurse doesn't necessarily mean that you understand coding. And selecting from a super bill is not coding. Okay, I will say that. But with that said, I just want people to understand that this is what happens, okay? Just because they say that it's going outsourced doesn't mean that it's going overseas. Because some of these hospitals will have it in their contract that these coders have to be US based. They cannot be overseas, and that is for the protection of their records. And so they have to consider that as well. When you are doing any kind of contracting with a coding company or the coding company in the hospital, or drawing these contracts out, there's a lot of fine print in there, and it's a lot of, okay, well, this is where we know our records are going to go. It is your responsibility to ensure that these people protect these records, you know, because we can't have any breaches of HIPAA in here. So, you know, that's also part of it. So that's the thing that I say. But that's why I tell you guys, even when a lot of y'all insist, oh, I want to travel and code. I don't know who says that that's a good idea. It's just foolish, guys. It's foolish. And I don't care if you dislike that. I don't care. The thing about it is that if you're sitting here trying to connect to Wi-Fi all willy-nilly because you think you can travel and do this, you're wrong. Because guess what happens? It's not a secure connection, and you are putting all these records at risk. Yes, you can connect to the VPN and things like that, but what if you can't get connected to the internet? You know, internet is not everywhere, and sometimes the connection is not always stable either. So that's another thing you have to think about when you are doing remote coding for an outsourced company. That's why they tell you, you have to tell us where you are. Where is the physical address where our equipment will be? That's why they send you equipment. You're not using your own computer, you know. I get those questions too of, you know, what kind of computer should I get? And what is the processing speed and all this other foolery. I don't know, guys. I'm not tech savvy. And I've worked with the computers, and it's always been the company's computer, you know, so I never had to worry about any of that. Even when I'm studying, I don't worry about the processing speed. Does it work? Can I connect to the internet? That's all I need. Literally, that's all I need. Everything else I can get from the book. Just saying, you know. So with that said, just because you hear that about outsourcing doesn't mean that coding is going away. You just have to find out who the company is so that you can apply directly with them. There's also, you know, applying with other places where they have a coder in-house. And I would recommend that if this organization is like, oh, we only hire the billers here, and, you know, some other place does the coding, I would go somewhere else. But that's just me, only because I'm looking at the coding. You know, if you are a biller who has a coding certification, and maybe you are the only biller in that organization that has a certification, this makes you very valuable. Why? Because you're going to immediately understand the buck's going to stop with you. Buck stops with you before it goes to the insurance company. So you can see all of those codes that are going to go out. And maybe you might not recognize something right off the top of your head or right away, but after a while, when you do understand more about the coding, you're going to be able to say, okay, wait a second, that one needs a modifier, or wait a second, they're sequencing wrong here, you know. So that is part of it. That's the thing that you have to think about when you are in these positions and you're using your skill. Now, again, yes, working in billing is great to start, all right? But if coding long-term is your long-term goal, you want to make sure that you have a date that you want to, you know, either wrap up the billing, or you want to say to yourself, okay, is this where I'm going to stay? Because some people really enjoy billing, and they said that, you know, they would rather do that than the coding. And then there's people that say they would rather do the coding than the billing. I will always do the coding only because Insurance does change. It does, update, and it does change its mind whenever they want to. And coding, it's a little bit more, yes, things do change, things do update, but it's a little bit more scheduled, okay? We are on a schedule with these changes and updates, and rarely does it happen mid-year. Like when we were in the pandemic, of course, that was a special situation, but that doesn't always happen. So there's that. But yes, so be careful when you are out there and you have your certification and you're in a situation like this. Well, are you only doing the billing, or are you doing coding as well? Because if you're doing billing and coding, be careful, because then you should be able to negotiate your salary once you have more experience. This person is brand new still, and they just got their certification. But again, if long term you are doing billing and coding, you need to negotiate later on for that knowledge that you're bringing, for that skill you're bringing in, because billers do not have to be certified. If you look on the job listings, medical billers do not have to be certified. Yes, there are billing credentials out there. However, it is not necessary, because when you look at the job listings, it will say candidate must have a high school diploma or a GED, and they usually want you to have experience. A lot of times, even if you don't have experience, that's fine. They'll take you on anyway, because they have to train their people. A lot of times, because different insurances require different things, it is needed to have to be able to train the people when they come in. So as long as you're ready and able to be trained, again, you don't have to be certified. It doesn't require a medical coding certification. Although I will always say that billers should understand coding, and not just enough just to get you around. I do think that billers should have an in-depth understanding of coding, because you see a lot of it. A lot of times I'm just like, what the heck is wrong going on here, And it's the billers, because they don't have coders in-house. They just have billers, and I'm just like, are you serious? Anytime you go to the doctor too, you'll see that as well. You'll see the front desk staff circling the codes. They'll select this or they'll select that, and I'm just like, are you serious? Do y'all even know what you're doing? You know what I mean? Like, I don't get it. But this is what happens again when people don't know what we do. But when people understand what we do as health information professionals, medical coders, medical billers, anybody in the revenue cycle, when you understand what we do, it makes all the difference in the world. And you will be able to see that difference in that facility in terms of their money, in terms of their, the consistency of their statistics and everything else. Because if you have poorly trained coders there, or incompetent coders, or you have incompetent leadership that is stewarding these coders, and they don't really know what they're doing, it shows. It really does show, because when you have an outside auditor come in and look at your stuff and they say, well, wait a second, what's going on here? It could be a big problem, so you always want to make sure that you're doing things right as a coder. You want to make sure that no matter what, you always make sure that you verify everything. Don't take things at somebody's word. Like this person saying that, that they heard words about people in Colorado outsourcing all of their coding. That's not true. Because even I looked in these job listings, and I've seen where they're hiring coders in-house. And this is in the state of Colorado. So, again, it's just, you have to be careful who you're listening to, because you never know why somebody's telling you something, right? So if somebody's telling you, hey, yeah, all these companies, all these hospitals are going to be sending out their coding work. Oh, but we're going to talk to you about coding. Did that person just save themselves money by not having to hire a coder, but could hire a biller who also does the coding as well? I'm going to leave that one right there, and I'm going to let y'all think that one out. Of course, I could be completely wrong, okay? These are, after all, my opinions, but I just want people to know something, is that whenever you are sharing about your skill, you have to be careful, because you never know who's listening, and you never know who could say, well, this person can do a lot. This person knows this. This person knows that. You know, and then all of a sudden you find yourself doing all of this work and not getting paid for it. Be careful. I'm telling y'all, just be careful. But y'all do what y'all do, okay? I'm just saying this because I've seen this happen too many times to these people that they apply for medical secretary, and then all of a sudden, oh yeah, they're letting me do the coding as well. It's not really coding, it's just circling from the super bill, or sometimes they're having to look at denials. Are they paying you to be a coder, or are they just paying you to be a secretary? Oh, a secretary. Okay, well, guess what? They got a 2-for-1 out of you. Are you ever going to make more money? Probably not. And it's probably going to take you a long time to get there if you're not applying where your skill set is going to be used appropriately. I'm going to leave that there. So with that said, don't worry about these outsourcing. Oh, it's outsourced. Don't worry about it, and stop listening to other people. That's the most frustrating thing to me when I see these new people, because a lot of times these new people are listening to people who are new themselves and don't know, or who are selling a program, trying to take advantage and doing a bunch of other things, trying to sell them things that they don't even need. It's heartbreaking to hear that. It's heartbreaking to hear people get taken advantage of. Somebody was telling me that they got taken advantage of for $1,500. And that they'll help them with the job search and resumes and things like that. That's, to me, it's just, I can't stand that. It aggravates me so bad because people get taken advantage of like that. But this is why I tell y'all have to start asking questions yourself, not just believing everything that you hear right off the bat, you know, because again, what is this person telling you, and what is the thing? What is their motivation for telling you whatever it is that they're telling you? For me, for my motivation is to educate y'all. Some of y'all don't want to be educated. That's fine. I'm going to educate those who are going to listen anyway. Okay. I have no dog in the fight with you as far as like, okay, well, you know, whether you pursue medical coding or not, it really makes no difference in my life. I'm already in my own career, you know, so I'm just trying to help you. Okay. So again, think about that. All right. So with that said, I'm going to go ahead and wrap this one up. But if you're out there, apply. If you're applying at a hospital and they say that we don't hire coders in-house, you know, this other company does it. Go research the company and apply directly with them. So that way you can get on with them and you can get going. All right. And you never know. But again, I will always tell my new people, make sure that you're working someplace where you're actually, in-house, and so that you can get your experience and exposure to other coders. Just saying. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.